Aloha guys, Dr. Tom is back again. We're going to talk about Chapter 12, Death and Dying. And it's our last chapter for the course, so how appropriate. Objectives. Identify cultural perspectives on death. Recognize the role individuals, families, hospitals, medical community, courts, legislatures, and others play in dealing with the ethical, legal, medical, social, and political questions that arise from our ability to maintain life. Articulate the need for a do not resuscitate. This is important to know, guys, DNR. Order from the patient's perspective. Weigh both sides of the question in cases removing life support. Identify provisions of the Patient Self-Determination Act. Attitudes towards death and dying. Death and dying issues question both the sanctity and the quality of life. All healthcare employees are affected by their nearness to and interaction with patients. A variety of influences shape our thoughts and feelings about death and dying. Family, religion or spirituality, media, society, and life experiences. Attitudes towards death and dying continued. Physicians routinely face questions about death and dying. I would think so. When a cure is not possible, a physician's obligation is to care for and comfort the dying patient, which certainly that's the way it should be. Determination of death. Ethical, legal, and medical issues arise that require a thorough analysis of the question, when is a person dead? Uniform Determination of Death Act. An individual who has sustained either, number one, irreversible cessation of circulatory and respiratory functions, typo there, or irreversible cessation of all functions of the entire brain, including the brainstem, is dead. A determination of death must be made in accordance with accepted medical standards. When organ transplantation became possible, they changed the definition of death from a ceasing of heartbeat to the cessation of brainwave activity. Now, I'm not saying they shouldn't have done it, but what it does, it allows them to take the organs out of people whose heart's still beating, and that's the whole idea. Why? Because those organs are precious and they're worth a lot of money, and they're sensitive, and they can't stand being cut off from oxygen for very long. So you change the definition of death to, well, it's when you don't have any brain activity, and then they can go in there and get them out. Advanced directives. Now, I'm not saying that's right or wrong. I'm saying this. There are many cases on the books where patients had no brain activity at all and later recovered and had normal function or some function. So it's not quite the absolute determiner of death that it's made out to be. I looked into this quite a bit. I wrote about it one time. Okay, advanced directives asserts an individual's right to accept or refuse treatment, and gives direction to relatives, friends, and medical professionals. Patient Self-Determination Act, living wills, durable power of attorney, healthcare proxy. Okay, the Self-Determination Act includes all hospitals, nursing homes, rehabilitation facilities, and hospices. The legislation is linked to Medicare and Medicaid payment. So in other words, guys, if a patient's badly sick, not going to get better, they have some say-so about what should take place with their treatment. Okay, under the legislation, the hospitals must provide written information to the patient on admission, informing them of their rights under state law to executive advance directives. Provide written information about policies to carry out these rights. Document whether an advance directive exists for each patient. Educate their staff and community on advance directives. In other words, a person has a right to whether they continue to live or not if they're terminally ill and in extreme pain or extremely disabled. PSDA right to choose. An advance directive asserts an individual's right to choose, accept, or refuse treatment. Gives direction to relatives, friends, and medical professionals. What do I think about that? Absolutely, they absolutely have the right to decide whether they want treatment or not. And if it's going to result in their death, that's their decision. The law affecting death and dying reflects how society regards older people. Advance directives are a result of a need for evidence. I know what you're thinking, Sue. Dr. Tom, God decides when we're going to die. Well, maybe he does. Maybe I'm not arguing that. You have your beliefs and I have my opinions and so on. But if you're not going to make it, guys, and you're in bad shape and you're in pain and you're in a diaper and you can't move and you have no quality of life whatsoever, don't tell me I can't decide that I want to die under those conditions. And that's what this law says. Living wills. A living will is executed when an individual is competent. Statutes cover only patients who are terminally ill. Living wills are accepted by courts and physicians. A person who's terminally ill can say, hey, if my heart stops, I don't want you to kickstart it and start it again. Just let me go. That's what this allows you to do legally. Durable power of attorney. All 50 states recognize some version of the durable power of attorney. The durable power of attorney document contains effective upon the disability or incapacity of the principal, or similar words indicating intent that the authority conferred continues despite disability or incapacity. That means the decisions they made are still good even if they're now completely incapacitated and unconscious. Other terms or types include Uniform Durable Power of Attorney Act, Uniform Probate Code, covers a broad range of illnesses linked to terminal illness when death is imminent. You got terminal brain cancer, or pancreatic cancer, nothing in this world is going to save you. You're hurting, you're suffering, you have a right to end it if you, or to stop treatment or to not be DNR. Do not resuscitate this person. If their heart stops, don't do CPR and put the shockers to them. Healthcare proxy identifies the principal and healthcare agent, might be a spouse, family member, expresses the intention that the agency has authority to make healthcare decisions on behalf of the principal, describes any limitations on the authority of the healthcare agent, indicates healthcare agent to make healthcare decisions effective upon a determination of incapacity. So this person has the right to make medical decisions for you. Usually it's going to be like I had to do that for my father. I was the oldest son. Can be revoked by notifying the agent or healthcare provider orally in writing or by any other act evidencing specific intent to revoke. Other ethical directives. Illegal except in 4 states. Advanced directive formats include euthanasia, suicide, assisted suicides, right to die, final exit network, patient-doctor relationship, death with dignity. I don't know what the 4, I think California is one of them. 4 states are, but there are 4 states where if you're in real bad shape and you decide it's your time, you can do it legally. Terminally ill patient. What is the purpose of providing care to a patient with no prospect of recovery? The hospice organization does that, guys, and they're wonderful people. They'll come out to your house, or they have hospice facilities that you can be admitted to. And they just give you the medications and the care you need to be comfortable until the end. And that's what it says here. Alleviate suffering, ensure the patient as comfortable as possible. Palliative care means just treating the symptoms, making them comfortable. Coordinated medical care intended to provide relief from seriously ill patients' physical or mental discomfort. So palliative care is not treating them. It's just helping them get over it, guys. Well, to tell you how this is, many years ago, they actually would quit giving pain medicine to a terminal cancer patient because they were afraid they'd become addicted. Now think about this for a minute, guys. You have terminal cancer. Nothing will save you in this world unless a bunch of prayer or something does. You're suffering horrible pain. And these jerks are afraid to make you a drug addict in your last few weeks on earth. Is that not the stupidest thing you've ever frickin' heard in your life? Well, that's my thoughts. And fortunately, over the years, they realized this, and that stupidity is no longer an issue. Still is in China, though. I've as I often say, I've dwelt among the Chinese for many years, and they still have some of that. Well, they will make them a drug addict. Do physicians with the intent of providing a death with dignity have the obligation to inform patients of the various ways of dying that are available to them, or to assist them with dying? Well, you got to be very careful, guys, or you'll end up in prison. Right to die statutes are in 4 states. Crime to kill someone, assist with suicide, or commit suicide. So there apparently are 4 states, at least when the textbook was written, that the doctor can assist you, and the other ones, no. They'll get them for murder or manslaughter or whatever. Okay, Dnr Orders. Treatment of cardiopulmonary arrest with cardiovascular resuscitation, CPR. Awareness of the legal need to have do not resuscitate orders in effect. Lead to action against express consent of the patient. Do not resuscitate orders have been legally recognized. Individuals have the right to make decisions affecting their own death. That's good. I completely agree with that. And they actually have a sign or something up, I think, in the hospitals. Do not resuscitate. Why? Because the person is in bad shape, guys. They know they're not going to live long. They're suffering. If their heart stops, they don't want to be shocked or ribs cracked doing CPR to try to kickstart them again. Implementing DNR orders. No uniform regulation about how to denote a patient's DNR wishes. Federal and state laws require orders to be kept in patient's chart. Carrying out those orders are up to the facility. I guess some of them they're afraid of the legal repercussions, I suppose, guys. Removal of life support. Life support removal is seen in society as an intentional act, and as in fact it is. Debate continues in all religions. No easy answers, often just more questions. Example, Terry Schiavo. This was several years ago. The lady, I don't remember the details. She was brain dead, but her husband wanted to let her die, take her off support. Her parents fought it for years. And because this woman was deemed brain dead, but yet her eyes could follow an object, and she could smile. And finally, I think, after a long time, the husband argued, look, there's no way that Terry would want to live under these conditions. But the parents fought. And finally, she died. I think they finally were allowed to cut off her feeding tube and that kind of thing. Euthanasia. Mercy killing or actively assisting someone to terminate their life at their request, Greek for good death, stems from Hippocrates. The physician is discouraged from invading the atrium of death. Instructed that in certain circumstances, attempts to cure must yield to attempts to comfort. Ethical issue, is this voluntary? Assisted suicides. Final Exit Network, accused of assisted suicide. I'm not familiar with this organization. Claims its volunteers do not perform assisted suicide. Provides compassionate presence, giving only information on suicide, including helium inhalation. I don't know if that would kill you. I mean, it would make you have a high voice for a while. Right to Die, Jack Kevorkian. He's dead now, the famous Dr. Kevorkian. Michigan doctor who assisted death of 130 terminally ill people. He eventually was prosecuted and sent to prison. He might have died in prison, I'm not sure. But Kevorkian became quite world famous. He said, look, if a person is terminally ill and they're in horrible pain, they're not going to get better, and they need me to help them cash in their chips, I'm going to do it. And he did a bunch of it, but he also finally got put in prison too. Death with dignity implemented. Patients assisted by family members. Attempt to commit suicide. Crime to aid in a suicide. Example, a Florida man shot wife with Alzheimer's disease, was sentenced to life imprisonment. A Massachusetts man suffocated his wife by placing her head in a plastic bag and sealing it with duct tape. He was not sentenced to prison, but placed on probation, which surprises me. The contract killing, an illegal contract, and unenforceable under contract law. Suicide. Medical professionals turn to the family to help them deal with their loss. Anger, insanity, guilt, and sorrow. Guilt and the feeling that maybe if I had done just a little more, it would not have happened. A disgrace to the family. Well, I suppose suicide does have a lot of negative connotation associated with it. Yes. A lot of these are ethical type questions, which is why we're studying them in ethics, and also religious issues. You have to be careful with religion, guys, because one person's religion is another person's hogwash. And because you believe that doesn't mean that others believe it. And it doesn't necessarily mean that you're right. So, I have respect for religion. I think it's a lot of important functions. But you can't use religious things to dictate laws to people and things. Because that's your belief. And so it deals with a lot, like disconnecting, we're almost finished here, disconnecting life support. They might say, well, God should decide when you're going to die. But we've already bypassed God with all of our modern technology. Now, if we hadn't been doing treatment on this person for the last 3 or 4 years, they would have died then. So haven't we already interfered with God's plan? See, that's the kind of thing you get into there. Again, your religion is absolutely your business, your prerogative. But I don't want my laws being based on because you're a Mooney or something. Okay. All right, guys, we're finished up. Very interesting points. There are, as you can see, different processes that are in place to help a person with these difficult decisions. Okay. we're finished up, and so we'll see you next time. Dr. Thomas signing off.